Gentlemen, let me ask you something that most men never stop to think about. Can HIV really enter through the eyes, from a drop of blood, a splash in a hospital, or even from someone's tear? Every year in the United States, more than 58,000 new HIV cases are reported, and around 2 to 3% of occupational exposures involve the eyes. Yet, less than 10% of men actually know what the real risk is. Most people panic when they see blood near their eyes, but the truth is more scientific and surprisingly reassuring. Still, there is one hidden detail every man should understand before it's too late. In this video, I'll share 5 facts that could literally save your life. The truth is not what you fear, but what you need to know. If this topic matters to you, click subscribe and comment safe and smart. One single click means a lot. Your support helps me build this channel and reach more men who need clarity. And stay until the end. I'll reveal one overlooked prevention secret most men never hear about. A man living with HIV once looked at me, eyes tense and voice shaking, and asked, "Doctor, could I have gotten HIV through my eye?" He had been helping a stranger who was bleeding after a street accident, and a tiny splash reached his eyelid before he could turn away and rinse. In that moment, fear did what fear always does. It told him a total story from a single drop, and it made his next heartbeat feel like a verdict. Here is the reality, as plainly as I can give it to you as a physician. HIV needs 2 things to even have a chance: fluid that actually contains the virus, and a pathway for that virus to reach living tissue. A break, an inflamed surface, or a vulnerable mucous membrane. Without both conditions together, the chain of transmission breaks, and the scary "what if" dissolves into biology, not doom. Let's add perspective with numbers we use in clinics. The estimated risk for a one-time exposure of HIV-positive blood to a mucous membrane, like the eye, is roughly 1 in 1,000, about 0.09%. And that estimate assumes the fluid truly contains virus and touches unprotected tissue. By comparison, casual contact, tears, sweat, or a droplet from normal conversation simply do not carry enough virus to infect someone's eye. So why did his fear feel so certain? Because the eye is precious, and because blood is visually alarming, our brains link seen danger with inevitable infection, even when the science says otherwise and the probabilities are firmly on your side when you respond correctly and promptly. In practice, rinsing immediately, reporting the incident, and letting professionals assess the risk make far more difference than the splash itself ever could. Let me be medically precise about tear fluid versus blood. HIV has been detected in tears at extremely low levels in rare research settings, but not at the concentration or form that leads to transmission during routine contact, caregiving, or ordinary life. Blood, however, can carry sufficient virus, and if it touches a compromised surface, the risk becomes real but still small and manageable with timely action. Here is the truth I want you to keep. It's not the presence of moisture on the eye that matters most. It's the identity of the fluid and the condition of the tissue it touches, plus how quickly you act in the first minutes. Please remember it. It's not the tear itself, it's what hides inside it that matters. During a hectic shift, a nurse assisting a trauma patient felt a small blood splash brush the corner of her eye, and moments later she asked me the same question men ask. Could HIV really enter through the eye from that tiny contact? Here is the calm, science-first answer I give my staff and my patients. Transmission requires 2 conditions together: fluid that truly contains virus, and a vulnerable pathway such as an inflamed conjunctiva, a surface abrasion, or direct contact with unprotected mucous membrane. Scientific finding number 1. Human tears themselves do not carry HIV at levels known to cause infection in everyday life, caregiving, or conversation. Detecting traces in specialized laboratories is not the same as a dose capable of establishing infection in the real world. Scientific finding number 2. Risk exists only when infectious blood or genital fluid contacts the eye's mucosa and that surface is compromised or highly inflamed. Without both components aligned, the biological chain breaks, and fear should give way to practical, proportionate caution. Scientific finding number 3. Immediate, generous irrigation matters. Flushing the eye continuously with clean water or sterile saline for 15 minutes dilutes and physically removes viral particles, which occupational medicine protocols estimate can reduce practical risk dramatically, on the order of roughly 90%. Scientific finding number 4. Timing saves lives. Post-exposure prophylaxis, or PEP, started as soon as possible, ideally within the first 72 hours, can prevent the virus from establishing infection, especially when combined with documentation of the source and follow-up testing at recommended intervals. Scientific finding number 5. Never rub or touch the eye with potentially contaminated fingers or gloves. Mechanical rubbing can micro-abrade the surface and push material deeper, whereas hands-off, flush, report, and seek evaluation is the safer sequence for anyone outside a controlled clinical setting. As a physician, I want you prepared, not petrified. The difference is knowledge applied in minutes, not myths replayed for months, because the eye's vulnerability is real yet manageable when you follow steps that convert a frightening splash into a contained, documented incident. Awareness is not alarmism. It is precision under pressure, knowing which fluids matter, which surfaces matter, and which decisions matter in the first hour, so you can choose action over anxiety and leave the emergency room with clarity rather than catastrophic rumination. Awareness isn't fear, it's your first line of defense. If this segment clarifies the path from exposure to safety, comment helpful, and share it with one colleague or family member who works around blood, because your knowledge today protects someone tomorrow. Across my years in practice, I have witnessed scenes that stay with you long after the sirens fade, and perhaps I am simply meant for this work, because those moments taught me the difference between danger imagined and danger defined by biology. Scenario 1. Roadside collision. A man kneels to compress a stranger's wound, and a faint mist catches the corner of his eye shield. The fear is immediate, but the risk remains low if the eye surface is intact and irrigation happens quickly and generously. What is risky here is visible blood striking unprotected mucosa or a scratched, inflamed conjunctiva, especially at close range with no eyewear and delayed rinsing. What is generally safe is distant spray, intact shields, or a droplet that touches skin, not eye. Scenario 2. Construction site injury. A co-worker's laceration bleeds while others rush in. One helper rubs his eye with a gloved hand that had contact with blood, converting a likely harmless situation into a higher risk by micro-abrading the surface and pressing material toward mucosa. The safer path is boring but powerful. Do not touch the eye, flush with clean water for 15 minutes, report the incident, document the source if possible, and let professionals assess. Most exposures de-escalate dramatically when steps are followed without panic or delay. What looks scary often isn't, but what looks harmless sometimes is. That sentence lives in my pocket for days like these, because calm, methodical action beats adrenaline every time, and knowing which fluids matter prevents you from replaying worst-case stories that the science does not support. Scenario 3. Clinical setting. A nurse removes a face shield to chart for just a second, and a patient coughs. Saliva reaches the cheek, not the eye, and anxiety spikes, yet ordinary saliva without blood does not carry sufficient virus. So reassurance plus education becomes the treatment. Mid-video. Let me invite you to strengthen this learning loop. Comment "safe" if this cleared one of your fears today, and share it with someone who works in health or rescue. Teaching one more person to rinse, report, and get evaluated might spare another week of sleeplessness. The common thread is simple and empowering. Proximity, Fluid type, tissue condition, and timing determine risk, not the drama of the scene. Protect your eyes, avoid rubbing, irrigate immediately, and remember that clarity under pressure turns frightening minutes into recoverable stories you can close. When in doubt, flush first, then seek professional evaluation without delay and documentation. Simple steps now prevent complicated worries later for you both. Patients and even medical workers often ask me, "Doctor, is there a sure way to know I'm safe after something splashes into my eye?" It's a fair question, and one that every person who's ever helped in an emergency deserves to understand without panic or guessing. The truth is, safety doesn't come from fear. It comes from fast, structured action. The same 4 steps we train hospital staff to follow, because these steps save lives when seconds count. Step 1. Flush for 15 minutes. Do not delay, do not wait for advice, and do not scrub the eye. Simply run clean water or sterile saline gently across the surface for 15 continuous minutes. This mechanical rinse reduces the amount of potential virus drastically, washing away over 90% of particles before they can even find a cell to enter. Step 2. Report immediately. Tell your supervisor, or if you're not at work, present yourself to the nearest emergency or urgent care center. Documentation protects you and allows professionals to trace the source, evaluate the level of exposure, and start preventive medication if it's warranted. Step 3. Assess and begin PEP, post-exposure prophylaxis. This is the crucial 72-hour window, the golden period where medicine can block the virus from replicating inside your body. Start sooner if possible. Every hour matters. PEP typically lasts 28 days and is most effective when initiated early and monitored by a clinician familiar with HIV care. Step 4. Follow-up. A single negative test immediately after exposure doesn't close the chapter. Schedule repeat testing at 6 weeks, 3 months, and sometimes 6 months, depending on protocol. Most patients who act promptly and complete PEP remain HIV negative, and that outcome isn't luck. It's precision, discipline, and timely care. Let me contrast 2 real moments from my career. One man rinsed his eye within seconds, received PEP within an hour, and never seroconverted. Another waited overnight, paralyzed by fear, and although his risk was still low, his anxiety consumed him far longer than the virus ever could have. The lesson is clear. Prevention is a process, not panic. Seconds matter. Panic doesn't help, but action does. Remember those 4 steps. Flush, report, assess, and follow up. They turn uncertainty into control, and control into confidence, because knowledge applied on time is the truest safety net any of us can hold. I want to correct a few common misunderstandings because clarity is a form of care, and it helps you breathe again when you or someone you love faces a frightening moment involving the eyes, blood, or a scene that looks worse than it is. After a suspected exposure, many people report a cascade of stress responses: sleepless nights, searches, headlines, and replayed memories that end badly, even when the science and the actual exposure details argue for calm, proportionate action, and simple, immediate steps. As your physician, I separate rational fear from irrational fear this way. Rational fear asks, what really happened, what fluids were involved, and what did I do within minutes? While irrational fear asks, what if everything I dread is true, despite the facts? Rational fear leads to protective behavior. You flush the eye for 15 minutes with water or saline. You avoid rubbing. You report the incident. You start evaluation promptly. And you let trained professionals translate probabilities into a plan you can live with. Irrational fear, by contrast, replaces steps with spirals. It invents certainty out of rumor, reads ambiguous symptoms as proof, and turns tolerable uncertainty into paralysis, which is cruel because it steals sleep and trust even when your actual risk remains small and controllable. So let me correct the beliefs that keep men awake. Ordinary tears and saliva without blood are not realistic transmission routes. While fresh blood contacting vulnerable eye tissue can be risky, yet even then, timely rinsing and professional care dramatically reduce that risk. Data, not dread, should guide your night. Document the source if possible. Start post-exposure evaluation. Consider PEP within 72 hours when indicated, and schedule follow-up testing on the recommended timeline, because closure comes from evidence gathered on time, not from endless scrolling. Talk to your clinician rather than to your search bar. Bring the exact exposure details, ask direct questions, and if anxiety spikes, borrow calm from someone who has walked this pathway: occupational health teams, peer counselors, or a trusted friend who understands the protocol. Your fear deserves facts, not silence. Your fear deserves facts, not silence. When we replace rumors with mechanism, numbers, and steps, the body settles, the mind rests, and the next right action appears, which is the very definition of safety returning to your day. If you catch yourself spiraling, use this simple sentence to interrupt it. I am acting on evidence, not anxiety. I flushed, I reported, I sought care, and I will follow the plan, because disciplined steps beat catastrophic guesses every single time. As a physician, I want to ask you directly, how do you protect your eyes when life gets messy? I have a simple habit that has protected colleagues, first responders, and families, and it protects me every shift. Here is the promised prevention secret, practical in the best way. Protect your eyes like you protect your skin. Wear goggles or a face shield whenever blood exposure is possible, even if the task seems quick, low risk, or just for a moment. Why do doctors and nurses wear eye protection for procedures that involve blood? Because risk is about how often something happens and the consequence if it does, and the eye's mucous membrane is efficient at absorbing and difficult to disinfect. Goggles and shields turn splashes into inconveniences. They convert a potential exposure into a cleanup, a report, and a return to work, rather than an anxious night counting hours to start PEP, arranging follow-up testing, and replaying every second in unhelpful slow motion. If you do not have medical gear at home or on the job, improvise wisely. Clear safety glasses from a hardware store, a face visor for home caregiving, or wraparound sports glasses during cleanup. Protection you use beats perfect gear you only meant to buy. Remember why we preach this. Your eyes are not symbolic, they are biological. A transparent shield can block virus-bearing fluid from touching vulnerable tissue, and barriers reduce accidents even when attention fades, fatigue rises, or you are rushing because someone needs help. Public awareness matters because misinformation breeds stigma and hesitation. When people fear each other more than they fear the virus, they delay care, hide exposures, and avoid testing, which helps no one and harms the communities we want to keep strong and healthy. Replace hush with help. Normalize eyewear in first aid kits. Teach children and caregivers to flush early and report promptly, and make testing routine rather than reactive. The more familiar these steps feel, the faster courage appears when a spill interrupts an afternoon. Knowledge shared is infection prevented. When you send this message to a coworker in construction, a parent who cleans up scraped knees, or a friend who volunteers at events, you multiply safety in ways no policy can reach, because culture travels faster than memos. And that simple habit is the difference between fear and freedom. A pair of goggles beside the bandages, a shield next to the gloves, and a calm plan beside your compassion mean you can step in, act fast, and leave the scene with confidence. Thank you for trusting me and staying with me until now. I know today's topic can feel heavy, but your patience is courage, and courage is contagious. Let me close the loop clearly, so you can leave with calm, confidence, and a plan. Here is the distilled truth. 5 facts matter most. 1. Tears do not carry HIV at infectious levels. 2. Risk needs infected fluid plus vulnerable tissue. 3. Rinse 15 minutes. 4. Start PEP within 72 hours. 5. Never rub your eyes. Here is the secret I promised. Protect your eyes like you protect your skin. Wear goggles or a face shield whenever blood exposure is possible. Barriers turn splashes into paperwork, not panic, and give you time to act. When fear spikes, lean on mechanism, not rumor. HIV needs the right fluid and the right doorway. Remove one and the chain breaks. Flushing, reporting, and PEP make biology your ally, replacing sleepless guesses with steps that work. Let this reshape how you see risk and responsibility. Protecting your eyes isn't just about vision, it's about clarity, courage, and care. That mindset calms emergencies, empowers helpers, and keeps families safer without feeding stigma. You stayed till the end, and that matters. Knowledge changes trajectories. You learned 5 facts, 1 prevention secret, and a simple protocol. Keep them visible. Goggles near bandages, saline by soap, and a plan. Compassion ready for moments. Share what you learned with someone who handles blood, cleans injuries, or works in rescue. When knowledge outruns rumor, stigma shrinks, and communities choose testing, treatment, and truth over hiding, delaying care, and imagining infections that never happened. If this message steadied your thinking, join me in building a culture of calm, competent response. Replace fear with preparation at home and work by making eyewear normal, flushing early, and speaking clearly about timelines, PEP, and appropriate follow-up. Join our mission for health education. Subscribe, share, and help one man stay safe. Comment "safe" and "smart" so I know this mattered. Your subscription strengthens this channel and helps me reach the next person who needs clarity.